Welcome, friends, to another episode of NTB Dialogues 9490 Global Voices series. As we know, all the governments in the world have committed to end tuberculosis by 2030. Time is clicking. The incidence of TB in high burden countries is very alarming. And that is why we have brought in frontline leaders from high burden countries who are championing efforts to fight the battle against TB. Today, we have Professor Michel Kaswa amongst us. Professor Michel Kaswa, welcome. Professor Michel Kaswa is the Director of National Tuberculosis Program in Democratic Republic of Congo. And Dr. Mariette Singa Kupa, she is the Head of Laboratory Monitoring in the country of Democratic Republic of Congo. So welcome both of you. Welcome, Dr. Kupa. Welcome, Professor Kaswa.
Okay, thank you.
Thank you. So before, sir, before we hear from you, I would like to show everyone people who are watching us on Facebook, YouTube, Instagram, and other media channels, is that on the World Health Organization, UN's health agency website, you will find a very important case study on DRC. And this is a golden example of how people are reaching the unreached in very, very difficult and hard circumstances. Finding out tuberculosis is so critical entry point, a gateway to TB treatment care pathway. Unless we find people with TB, how are we going to put them on treatment? So look at this. I will recommend everyone to go through this case study, see the great work which is happening in DRC, how they are striving hard to increase case detection so that all of them are put on treatment and get cured. And that is, treatment is prevention. When we put people on treatment, the disease stops spreading. That is a very important thing. So Professor Kaswa, now I should be the one who should keep a mouth shut, and we all look forward to hearing from you the great work which is happening in DRC in finding all to TB. Over to you, sir.
Thank you, sir. Thank you, sir. So now it's true what you are saying before. As probably you know, DRC is one of the top 30 high burden country for TB, HIV, and TB, and drug-resistant TB. And in 2022, we got the implementation phase study on TrueNAT MTB Plus and MTB RIF diagnostic testing. The challenge for us, it was what? Only at this time, only 9% in 2021, only 9% of people with TB were tested with rapid molecular tests. So it was an issue for our program to improve not only the capacity, but also the proportion of TB patients who have rapid molecular testing. That was the challenge. And at this time, TrueNAT came on the market, and through a Stop TB partnership and projects, new tools, we will be able to implement the TrueNAT technologies in 38 facilities in the south of the country. Rapidly, we got a very good impact. Overall, a total of 12,700 samples from individuals that undergoing investigation for TB were received between April and December 2022. The proportion, the main result was what? The proportion of newly diagnosed people with TB tested with a rapid molecular test has initially increased significantly from 11.7%. This was pre-TrueNet implementation to 65.9% during the TrueNet implementation. Similarly, the proportion of newly diagnosed people with TB that were bacteriological confirmed also increased significantly from 54.9 pre-TrueNet implementation phase to 67% during the TrueNet implementation. So using those results, we decide as a country, we decide to move to an extension TrueNet plan. And inside of our national strategic plan, which cover 24 to 2028, the aim is to purchase 8,200 new TrueNet machines in the near future, with the goal of reaching 400 instruments by the end of 2028. And we are sure that with all those machines, we can achieve one of our expectations. So what is this expectation? More than 60% of all people need to be diagnosed. They can use a rapid molecular diagnostic test for TB. This is what I can summarize what is the situation according right now in DRC. And we are now discussion with Global Fund to see how to come out with this expansion plan. Over.
Yeah, thank you so much, Professor Kaswa. Really so impressive to hear the impact of implementing the WHO recommended lab independent battery operated TrueNet. It's really amazing to see how the newly diagnosed percentages went up from 54.9 to 67. And most impressive is the number of people who were getting diagnosed with the molecular test went up from 11.7 to 65.9. That is huge. That is really game-changing. Because if we do not use molecular test, we are missing people if we use microscopy, if we use tests which underperform. It is really important to find all TB. And one of the ways is to replace microscopy with the molecular test. That is a WHO call from since 2018. WHO has called, and the United Nations high-level meeting last year, the world leaders promised that by 2027, all the countries will have 100% molecular test upfront. Let us hope that with leaders like you, this really becomes a reality, that everyone who takes a TB test gets a molecular test diagnosis. And if it is great to see. So, Dr. Kaswa, can you please help us understand, where did you deploy TrueNet? Was it in laboratories, in big cities? Was it in rural settings? Was it in prisons? Was it in hard-to-reach areas? So some insights from you will be really helpful.
Okay, using the different characteristics of the TrueNet machine, they allow us to deploy the machine in different settings, in different facilities. Some were in the prison. Another in the displaced population place, and other in the clinic, but most of them are in very remote and rural area. And we were able to do that with some, I can say, technical characteristic of the machine. You have this battery. So it's true that as in the developing country, you have some problem with electricity, but TrueNet help us with this battery that can work around 8 hours to solve this issue of electricity in our country. So we will be able to summarize, we will be able to put the machine in the normal TB clinic, but also in the specific place like prison, displaced population place, also in remote and rural area TB clinics. Over.
Yeah, thank you. Thank you so much. Professor Kaswa, this is really important because I come from India, and in India, it is really important to reach out to people who are in prisons, who are displaced or homeless people, or in remote and rural setting. That is where the health services are really weak. What about electricity? Was electricity an issue to recharge the batteries? Because I read on in the WHO on the WHO website that you were using, some sites have implemented solar energy to cope with power outages and prevent damages. This is amazing. Is it true? What was your experience? Over to you.
Yes, it was true. You know, in our country, the electricity fluctuation have sometimes influenced our results. So it was important to be sure that how to protect the voltage of the machine and to prevent also the risk of damage to the instrument. So we are be able to have on the solar panel to be sure that we have electricity firstly to have the battery fully working functionally in the good condition, and also to avoid these significant electricity fluctuation, I can say like that. So we will be able to solve this electricity issue in our specific context of developing country. I think it was an issue, but we will be able to solve this problem by using solar energy to stabilize the battery and to be sure that we can have our battery. I'm talking about the battery of the TrueNAT, able to work during at least 8 hours.
Great, great. Really an important lesson, Professor Kaswa. DRC is showing way to so many countries, including in India. There are electricity power outages, and it is important to find some local solutions that work. And solar power is surely one of them. And Professor Kaswa, it is a green alternative. It is an alternative which is environmentally and ecologically also helpful. But great to see you are deploying it in a way it is also having a positive impact. So, Professor Kaswa, are there any diagnostic delays? Are people being found early enough? Even we are finding it with molecular tests, but are you finding it early enough because so that we can stop the spread of infection? And are they linked to care and treatment?
Yes, I think no, there is no delay because you know what? My main message in our program, our vision is test, test, test again, and link to care. This is the main message. And the TrueNAT technology offers us this capacity that directly after testing, we are sure that we reduce any delay. The same days the patient was able to start with the treatment. So definitively, this is a great impact because, you know, as soon as possible that the patient's diagnosed, start the treatment, then you can stop the transmission chain of TB. So it's important for us that quickly the patient starts the treatment. But here, not only a treatment, but the adequate and the correct treatment, because we know that it's not a resistance, or we know that is a resistance, then you can start an adequate treatment. So that is two advantages that we found with the TrueNat technology. Over.
Yeah, thank you again. Really eye-opening to hear what, and such an important slogan, Dr. Kaswa: test, 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 and link to care. Test, 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 and link to care. And same-day test and treat must be a norm, not an exception. That is a rule. Same-day test and treat. And if we can diagnose in 1 hour, then it is. And if we can know that the person is resistant to rifampicin or not, we can put the person on treatment. And you are very right in saying we have to treat them, but treat them with medicines that work on them. So it's very important that that you are implementing technologies in such a powerful way. And thanks to the Stop TB partnership for supporting this. So, so Professor Kaswa, any other insights on when you look forward? This is 2025, and I look forward to meeting you in Goa in the meeting later this month. So hardly 5 years are left. So how can we accelerate the finding all TB in DRC, treating all TB in DRC, preventing all TB in DRC? Because as you rightly said, it is important to stop the spread of infection, and of course to bring every one of those who have TB into the TB treatment care fold. Over to you, sir.
Thank you, sir. And no, I guess it's important that quickly we solve the units and the global fund to be sure that we quickly to get this machine on board. That is something very, very important for us, because otherwise DRC will be not able to be part of the anti-TB in 2030. So what I'm doing now as NTP manager with all my staff, working closely with Global Fund is now within the country. We are discussing on this issue to get more molecular machine on board and to implement this technology to be sure that we can have a very good and rapid impact in the reduction of the TB incidence within our country. Over.
Yeah. Thank you so much. Thanks a lot. We really hope that happens. Thank you. And it is really important that all machines are in place, all medicine supplies are in place, so that you have all the tools, all the innovative new diagnostics and new treatments and people-centric approaches in place, so that we can end TB. Thank you, Dr. Kaswa. Any final thoughts before we wrap up, sir? Your message, any final thoughts? Yeah.
No. I think it's for me just to greet you. Thanks for the opportunity you give DRC to share our experience. We will continue to work closely with your team here in the country, and also with the founders, to be sure that according to our national strategic plan, we can purchase at least 100 TrueNat machine in the coming year. So we will be able to implement the entire project of using or scaling up rapid molecular tool for DRC population. So the other issue we will be able to discuss in Goa, I think later in May, when we will be there. Thank you, sir, and take care.
Thank you so much, Professor Michael Kaswa. A real honor and real pleasure talking to you. I'm Bobby Damakhan from CNS. Really looking forward to meeting you later this month. Have a safe flight, have a comfortable flight, and welcome to Goa. And Professor Kaswa, you are coming to Goa, which is the only Indian state which has completely replaced microscopy with 100% molecular test upfront. So you will get to meet the Dr. Manish Gonekar, who's the Delhi government leader who has made this happen. So really, it will be great that you have also, both of you are great leaders, and let us hope that that meeting goes fruitful. All the best, safe travels, comfortable flight. See you next time.
Okay, thank you. It will be a pleasure to meet Doctor and also to discuss with your team on different kind of issue and to share our experience. Thank you, sir. And
Thank you. Same here.
bye-bye.
Bye-bye.